It's about people sharing their knowledge of integrated care. There's many models around the world, and obviously as a small jurisdiction, we've set ourselves the ambition to be the best small island healthcare jurisdiction in the world. Huge ambition, and we've got to work towards that. And one of the ways of working towards that is sharing knowledge of other island nations of similar sizes to us and their experiences of trying to drive integrated care forward.
Are you setting yourselves at the highest standard then, and sort of presenting ourselves as already a particularly not ambitious, but a goal that other people should be looking towards?
That's what we want to do. I think we've got some very good examples of integrated care starting to move now. I'm not saying we're all the way there. I'm not saying we've got it 100% right and we should at the moment be holding ourselves up as a shining beacon for others to follow. But what we're doing at the moment is we're engaging with other small nations and we're learning from each other's experiences, because that's how you do end up actually delivering a proper system, not by doing it in isolation, but by learning with others.
How do you do that sort of logistically, physically? How will you be taking that forward then?
So at the moment there is the Small Islands group. They will be coming over to the island here later in the year to see what we're doing in practice, and it's actually seeing things on the ground and sharing experiences. So it's not a case of one summit, everyone goes away. There's constant communication between the islands, learning from what each other are doing and seeing what works and what doesn't. And of course, if it's not working somewhere else in a small island community, the likelihood is it's not going to work here. So we shouldn't be wasting our time repeating, not mistakes, but things that aren't working elsewhere.
What kind of areas of the department do you think will be the key focuses?
So the key focuses will be the main integrated care itself, of integrating services away from being the acute side into the community, because that is the whole point of integrated care. It's about delivering care in the right place at the right time, but also at a more local level.
Would that expand the integrated care we have on the island already then?
Very much so. And when you talk about integrated care, we're in the early stages really at the moment still. We still have a massive amount of focus on our acute side. As I've said, I want this year, 2019, to be the year of the community for the department, where we start looking at our community services and how we can put more into them to ensure that we can deliver things closer to people's homes and where people want their care.
What other small islands are we talking about, or small areas that equate to the island?
So you've got San Sebastian. We also have dialogue, obviously, with Jersey, with Guernsey, and other small island nations. It's basically small island nations around the world. So we're not just restricted to Europe or anything like that. It's all sorts of small island nations. So you're looking at island states with populations of up to 125,000, and also states and regions with populations of up to 500,000.
It's quite clear why we would compare ourselves to other sort of Channel Islands. Jersey, Guernsey makes sense because we're similar. What about the more further afield with completely different demographics and health demands? What can we learn from them?
Well, interesting that you mentioned very different demographics, very different health demands. A lot of the other small island nations like San Sebastian and so on, they are facing the same challenges that we are, of ageing populations, and that brings with it. So while the actual individual things they might be treating are different due to demographics, the challenge isn't. And the challenge is an ageing population that requires more services in the community. Otherwise, you're going to basically overload your acute side with the number of people coming through the doors, and you'll have ever expanding cost. So it's actually quite remarkable that around the world, although they're obviously different nations, they've got their own challenges, the high level themes are pretty much the same. And so it's interesting to see some of the things that those small island nations have done to try and flip their models. And I think there's things we can learn from that. There's other things, of course, that's not saying we'll just do what everyone else is doing. There's some things within those nations that won't suit the Isle of Man. But I think it's about learning best practice and also learning what has worked elsewhere and equally what hasn't.
How quickly is this already happening now? When will we first see some of these meetings take place? So
the meetings are already underway. There's a meeting going on this week, in fact. So we will be seeing results coming back from that pretty quickly. In relation to how we adapt it on the ground, that will obviously feed back into the pilot we're running in the West, but also our wider departmental strategy about how we deliver community services.